Right, you stay in KwaZulu-Natal. Ahead of World AIDS Day on the 1st of December, eThekwini says it's managed to keep HIV patients on treatment despite COVID-19, 2021 July Unrest and the April floods. Estimates indicate that 26.4% of the working age population in the province is HIV positive, compared to 15.9% in South Africa. eThekwini says despite frequent shocks to the system, partnerships and collaborations helped in re-engaging patients. Newzroom Afrika's Modise reports.
South Africa has the largest HIV epidemic in the world, and KwaZulu-Natal alone has the largest burden, with an estimated 2 million people living with the virus. eThekwini Executive Mayor Modise says although the metro has managed to retain patients, it also has a number of issues that contribute to new infections that require urgent attention.
Awukwazi ukuthi kuthiwa umuntu wesilisa ukhulelisa ingane na 14 years. Sibuye sikubize ngendoda, sithi uyindoda, awuyona indoda. Ayikho indoda engamithisa ingane encane na 14 years. Mase umndeni uyahlangana kuthiwa akuhlawule, akhishwe ihlawulo. Yilani lelo hlawulo? Kuhlawula bani? Ngoba already sesidestroy umuntu la.
Nobuhle, who was born with HIV, says although taking treatment has been a norm throughout her life, it hasn't been easy.
Not easy, but it's every day. And it's not easy to take every day, but we are trying because there's power. And I wish one day we have a cure for HIV.
COVID-19 and the April floods have particularly impacted eThekwini when it comes to rolling out treatment. Dr. Pelelani Sosibo says despite the unfavorable events, the number of patients taking treatment grew by almost 30,000 in the 2 years of coronavirus.
If anything, after the 10-day period of the civil unrest, we started gaining even more patients. By the time we were hit by the May floods of 2022, we actually had gained we had actually reached 463,000 cases, which actually translated to about 27,000 net gain in our ART program. So we actually were very, very much resilient as a city, despite all these challenges that we experienced in the last 2 or 3 years.
Dr. Sosibo says when people with HIV are not on treatment, the virus can multiply through their blood system, which makes it harder for their bodies to fight off infections.
For any particular period of time, missing treatment will mean that you are basically allowing the body to make new copies, the virus to make new copies, which might result in opportunistic infections, which will be a threat to a patient's life. So this is the reason why we have to make sure that our patients are always on treatment at all times.
Even in perfect conditions, people don't always stick with their HIV treatment. But with COVID-19, the 2021 July Unrest, as well as the April floods, things have definitely changed the way health workers work. Research shows that countries that have HIV policies that includes plans on how to deal with such issues are better equipped to deal with crises. For Newzroom Afrika on Channel 405, I'm Nobuhle Modise in Durban.